10 minutes to your health.
All right, folks, so when it comes to matters of the heart, we should all take it seriously. Joining us this morning to speak coronary artery disease is UWHI interventional cardiologist, Dr. Raquel Gordon. Good morning.
Morning.
To Smile Jamaica.
Morning.
Doc, who is an interventional cardiologist? What does that mean?
So an interventional cardiologist is someone actually who deals with the blood vessels of the heart in an instance where you're particularly having a heart attack or to prevent the heart attack. So if you have a blocked blood vessel, then we would open it either at the time you're having the heart attack or prior to that if you're having symptoms.
So isn't that surgery?
So it's an invasive procedure, but it's not really considered a surgical procedure because you're not really being cut open.
So you're not a surgeon?
No, I'm not a surgeon. I'm a medic.
Oh.
The challenge for me, Doc, is that the heart is a funny thing. It could be blocked for years and you don't know unless you keep going to get your checks.
Right.
Yeah, are there any signs?
Yes.
Very rare, but are there any signs that you can look for?
Yes, so there are signs. So particularly if you have risk factors such as high blood pressure, diabetes, if you're a heavy smoker. And
Genetics?
of course, if you're genetic mistakes, if you're a male, of course, you're at a higher risk for having coronary artery disease. And so some of the signs are...
Sorry to jump in. Why? Why if you're a male?
It's just studies have been proven that men are at a greater risk for having coronary artery disease based on your genetics.
Oh.
Yes.
Them not let out their emotions.
Sorry to jump in. Continue.
So so if you have chest pain, and chest pain mainly on exertion, so if you're walking and you realize that you have to stop walking before you can actually complete your journey because of significant chest pain, that is suspicious. Likewise, shortness of breath, similarly on exertion, that is also suspicious. Some people can also feel lightheaded or feel nauseous. This pain that is not going away, especially when you move about, that is suspicious. And that if you notice that it actually goes away when you're resting, then that is suspicious for coronary artery disease.
Chest pain, where particularly?
So usually we say retrosternal, so behind the chest, the wall here, or on the left side. Sometimes it radiates down to the left arm more typically, that's typical, up the jaw, and sometimes to the back is more characteristic of anginal type chest pain. And angina just refers to the pain that you get when the area of the heart is being starved of oxygen and nutrients.
Is there anything, apart from lifestyle issues, is there anything, because I read once that if you take the aspirin, the 81 something, if you take one every day, it helps with your heart? Is there anything that you can do before?
So prevention is really, yes, you can try to lead a healthy lifestyle. That's most important.
Okay.
So if you're a smoker, stop smoking. Exercise is always good, right? Try to keep your cholesterol level down. So in whatever way you try to eat a healthy, heart-healthy diet, as we call it. So a diet high in vegetables and low in bad fats, as we would call it. And of course, if you want to, the aspirin is recommended mainly for patients with risk factors. The studies have only shown that they lower the risk when you actually develop some risk factors. So we won't advocate for everybody to go and take aspirin. But if you have these risk factors and you have symptoms suspicious of having a heart attack, then we can recommend that you start taking an aspirin. Of course, see your doctor.
How prevalent is heart disease?
Oh my God, it is very prevalent. So it is a global burden right now. So in Jamaica it is. It's one of the leading cause of death, and we see people dying daily, to be honest with you, from a heart attack.
What?
Some unfortunately don't make it to the hospital because they have sudden death, either from how significant the heart attack is, or when the muscle is damaged, it causes what we call an electrical conduction problem, and so that causes your heart to stop beating suddenly. So it is actually common, and again, unfortunately, more common in males, but it's one of the leading causes of death in Jamaica and the world.
Why, Doc, you're not bringing no good news this morning?
And that's why I'm really here, because we have our cardiovascular week coming up, and this is what we're trying to, next week from running from February 9th to 15th, which we are trying to highlight coronary artery disease because we realize that the burden is great and we want to try and prevent it because the complications of a heart attack are great. And sometimes they become lifelong because you develop the congestive heart failure and you develop the arrhythmias and you're in and out of hospital.
We have to go. Anything significant happening in the week?
So what is significant is that we are having a symposium on Friday on Valentine's Day from 12:30 to 5 p.m. We're highlighting coronary artery disease. We also start off the week with a church service, which is on Sunday at Swallowfield Chapel, starting at 10:45, and we'll be having in-hospital presentations throughout the week, inviting schools as well to join us, and the Heart Foundation will be there to help us with doing checks, blood pressures, and if we need to do any referrals, we will be doing referrals.
Thanks for coming.
Thank you for having me.
All the very best. Dr. Raquel Gordon, sit with us for a while. Interventional cardiologist at the University Hospital, the West Indies.
We're going to wrap things up after the break, so please stay with us.
10 minutes to your health